You are a first responder trained in basic life support. You volunteer in the local elementary school working with kindergarten students. You are in the school gymnasium and see one of the students collapse to the floor. You approach the child on the floor. You note that the boy is small and appears to be approximately 5 years old. 1. Your first action is to A. Establish unresponsiveness. B. Ensure scene safety. C. Feel for a pulse. D. Begin CPR. Correct answer, B. Ensure scene safety. In any situation, you must first determine that the scene is safe for the victim and you. You quickly scan the surroundings and determine that there are no threats and that both you and the victim are safe. 2. The next step you should take is to A. Establish unresponsiveness. B. Check for a pulse and breathing. C. Begin CPR. D. Begin rescue breathing. Correct answer, A. Establish unresponsiveness. If the victim is responsive, you should try to determine how they feel. You determine that the child is not responsive. 3. The next step you should take is to A. Begin CPR. B. Monitor the victim until the AED arrives. C. Check for a pulse and breathing. D. Begin rescue breathing. Correct answer, C. Check for a pulse and breathing. You should do these actions simultaneously and for no longer than 10 seconds. You determine that you cannot feel the child's pulse. The next step you should take is to A. Monitor the victim. B. Begin CPR. C. Begin rescue breathing. D. Attempt to bring the victim up to a sitting position to provide a better airway. Correct answer, B. Begin CPR. Since this was a witnessed collapse, you send a bystander to retrieve the AED that is on the wall in the gym. You also tell them to call EMS. 5. As a single rescuer, you know that CPR cycles of compressions to rescue breaths should be A. 15 to 1. B. 15 to 2. C. 30 to 1. D. 30 to 2. Correct answer, D. 30 to 2. If 2 rescuers are available, change the compression to ventilation ratio to 15 to 2. You do CPR until the bystander brings the AED. 6. At this point, you should A. Continue CPR. B. Continue to monitor the victim. C. Open the AED case. D. Attempt to bring the victim up to a sitting position to provide a better airway. Correct answer, C. Open the AED case. It is important to determine as quickly as possible whether or not the child is in a shockable rhythm. Shocking the victim in a shockable rhythm is the most important thing you can do. You continue CPR as the bystander turns the AED machine on and connects the wires to the machine. You stop CPR and open the child's shirt to expose his chest. 7. Your next action is to A. Apply the AED pads. B. Roll the victim to his side. C. Begin rescue breathing. D. Attempt to bring the victim up to a sitting position to provide a better airway. Correct answer A. Apply the AED pads. It is important to apply the pads quickly so the AED machine can analyze the rhythm. 8. For this child, the correct position for the pads are A. Left upper chest and right ribs under the armpit. B. Right upper chest and left ribs under the armpit. C. Anterior and posterior chest. D. Responses B or C. E. Responses A and C. Correct answer D. Depending on the size of the child and the size of the AED pads, either B or C might be appropriate. You apply the AED pads and instruct everyone not to touch the child as the AED machine analyzes his rhythm. The AED advises shocking the victim. 9. The next step you should take is to A. Resume CPR. B. Push the shock button on the AED machine. C. Call out for everyone to stand clear of the victim. D. Wait for a second reminder from the AED to shock the victim. Correct answer C. Call out for everyone to stand clear of the victim. You verify that no one is touching the victim. 10. Your next action is to A. Push the shock button. B. Resume CPR. C. Quickly check the pulse and breathing. D. Wait for EMS. Correct answer A. Push the shock button on the AED. If the victim is in a shockable rhythm, the AED can provide the defibrillation he needs. Do not delay this step. 11. After the shock is delivered, the next action you should take is to A. Allow the AED to analyze the rhythm. B. Begin CPR. C. Begin rescue breathing. D. Wait for EMS. Correct answer B. Following a shock, begin CPR immediately for 2 minutes or until the AED advises that it is time for another rhythm check. The AED advises stopping CPR. You move back from the victim and allow the AED to analyze the rhythm. The AED advises continuing CPR. 12. You understand that the reason the AED did not advise another shock is that A. The AED did not detect a shockable rhythm. B. Defibrillation should not happen more often than every 5 minutes. C. CPR is better than defibrillation. D. All of the above. Correct answer A. The AED did not detect a shockable rhythm. The AED will only advise a shock when it detects one of the shockable rhythms. 13. Shockable rhythms include all of the following except A. Ventricular tachycardia. B. Coarse ventricular fibrillation. C. Asystole. D. All of these rhythms are shockable. Correct answer C. Asystole is not a shockable rhythm. You continue CPR, and EMS arrives a few seconds later to take over treatment and transport the child to the hospital.